Hello, my name is So Young-han. I'm in a doctor's course in Gangwon National University and an occupational therapist Bubas Memorial Hospital in Gyeonggi-do. My journal topic is the effect of the trunk stability training on reaching function in hemiplegic patients after stroke. Contents is as follows. Next, introduction. Most of the stroke patients recover their working ability, but about 30 to 66% lose the affected upper limb function. Among the upper limb functions, the reaching function refers to the rapid movement of a hand toward an object in order to grasp an object, and is a very important fact in the quality and independence of everyday life. The dysfunctions of reaching movement affect the integration of patient life and as a result limit independence in activities of daily living, such as eating, dressing, and toileting, essential of daily life. In addition, sensory and motor functions of patients, the trunk are impaired, resulting in posture and performance problems. The trunk stabilization exercise plays an important role in the stability and posture control of the trunk by increasing the stability of the spine and pelvis during functional postures and movement. Therefore, this study aims to investigate the effect of upper extremity therapy combined with trunk stability training in stroke hemiplegic patients. Next, materials and method. The subject of this study were 25 patients who were diagnosed with stroke and B hospital in Gyeonggi-do. Those who have agreed voluntarily participate in the study are selected as follows. 1. Those with a score of 23 or higher on the K-MOCA. 2. Those who did not have pain or musculoskeletal disease on the upper limbs. 3. Those who can detect when stimulating the effect hand. 4. Those who can sit or walk. The reaching function test was measured with the CMS-10 of Jeffries Medical GmbH, a three-dimensional motion analysis system for the upper limb. This is a tool that can analyze the movement of the upper limb function in 3 dimensions. In this study, the movement toward the goal was analyzed. Next, it is research follow-up chart. It is method. Upper limb therapy combined with trunk stability training. 1. Restoring the segmental and cooperative extension of the trunk and pelvis on a stable base of support through muscle activation alignment of the upper limb of the lower limb. 2. Promoting the stabilizations of the thorax and the repositioning of the shoulder to restore the center line of the trunk. 3. Activate the contact ability of the hand and the ground to enhance the ability. General occupational therapy. The general occupational therapy intervention applied in this study was a conventional treatment for stroke patient, and the task designed by using the tool commonly used in the clinical field were performed. Next is result. Clinical parameters before and after treatment. Table 1 shows change in reaching speed in both groups before and after intervention. There was a statistically significant difference between the reaching speed in the experimental group. Compare this of result between the experimental and control group. Changes in reaching speed between the experimental group and the control group after the intervention are shown in table 2. There was no statistically significant difference between the two groups after intervention. Next is discussion. Reaching motion is very important in the performance of daily life movement, and in the case of stroke patient, the impairment of operating function is the main cause of making activities of daily living difficult. Trunk stability training is required because abnormal operating body coordinations during task performance interferes with learning of normal motor control. The purpose of this study was to evaluate the effectiveness of operating treatment combined with trunk stability training. There was statistically significant difference in the mean reaching speed in the experimental group, but not significantly in the control group. There was no statistically significant difference mean reaching speed in intergroup comparison. Therefore, further research should be conducted through sufficient interventions targeting more and more patients. The last conclusion. The purpose of this study was to investigate the effect of upper extremity therapy combined with trunk stability training and to improve the operating function of hemiplegic patients. The study showed the effect of upper extremity therapy combined with trunk stability training for improving some aspects of motor control strategies of the affected arm. Thanks for your attention.